This is Real News Media TV, coverage you can trust. Please like, share, subscribe, and hit the notification bell. Select all for daily news updates. Meadows ends toxic ties with the JLP. Dennis Meadows has quit membership of the ruling Jamaica Labour Party. The separation took effect on March 24. In his parting shot to the JLP, Meadows disclosed that he has had a toxic relationship with the party for the last 8 years. A photograph of Meadows with the People's National Party blogger Kamala Forbes has been making the rounds on social media. Meadows was non-committal about his political future. "I have served the JLP from the days of my youth and most of my adult life, but I cannot confirm nor deny that I have an interest in becoming a member of the PNP," he said in response to queries from the news. A reliable source within the opposition People's National Party's hierarchy in Trelawney Northern has confirmed that there have been talks with Meadows about his political ambitions. Meadows unsuccessfully challenged Dr. Patrick Harris in Trelawney Northern in 2007, polling 8,642 votes to Harris's 10,164. He also lost to Patrick Atkinson in the 2011 general election. Atkinson tallied 10,869 votes to Meadows' 8,548. On his third try in 2016, Meadows was once again defeated by People's National Party's Victor Wright by a margin of just under 500 votes. Wright polled 9,611 votes, and Meadows received 9,162. Meadows has come under scrutiny recently after being finger-pointed by Firearm Licensing Authority CEO Shane Darling as one of several officials who between 2014 and 2017 granted gun permits to more than 200 people with criminal convictions or adverse traces. Meadows had served as a deputy chairman of the board. Documents seen by the news also showed that Clinton Rennie, Meadows' brother-in-law, was among the more than 200 people of questionable character granted license. Meadows had denied wrongdoing. MOH urges continued precaution against the COVID-19. Medical Officer of Health for Hanover, Dr. Kosel Singh, is advising Jamaicans to continue following health precautions established under the Disaster Risk Management Act to prevent contracting the COVID-19 virus. The caution comes against the background of the relaxation of mask wearing and other previous requirements under the DRMA as of Friday. I pause to state that although after April 15, mask mandate will be expired, I will hasten to advise the population to take precautions. Still wear your mask while you are in enclosed areas, Singh stated, while tabling a report from the Hanover Health Department at the Hanover Municipal Corporation's monthly meeting in Lucy on Thursday. Singh posited the importance of persons still getting vaccinated, adding that it will help in protecting family and friends, especially those who are counted among the group which is vulnerable to critical illnesses. Turning his attention to the COVID-19 situation in Hanover, he pointed out that for March, there was a steady decline in the number of new cases in the parish. When we calculated at the end of March, we had 68 COVID-19 cases recorded in the parish for the month. The cumulative number of confirmed positive cases was 4,153. By the end of the month, there were only 10 active cases, with approximately 3,811 or 92% of total cases in the parish fully recovered, he stated. Singh credited the vaccination rate within the parish as a contributor factor to the recovery rate, even though he described that rate as static. Quoting statistics from the Western Medical Journal, Singh said that Hanover has the second largest number of obese persons in the island, second highest number in terms of persons having hypertension in its population, and with a comparative high percentage of its population being diabetic. These people are vulnerable for critical illnesses. Look at it, just add it up. Most of the population of the parish are vulnerable, so that is why I am asking the population to still observe preventative practices. Protect your family, your household, and your neighborhood, he stressed, noting that the rate of persons seeking vaccination against the COVID-19 virus has been static. Singh pointed out that the HHD has adopted several measures to convince persons to get vaccinated. One such measure involves the employment and the training of 50 persons described as Vax ambassadors, whose responsibility will be to speak to persons in communities across the parish and inform them about the benefits and importance to taking the vaccine. This is with a view to encouraging them to take the vaccine from an informed perspective, Singh noted. Singh also advised that as summer draws near, persons should be on the lookout for mosquito-borne diseases. As per our data after May, from the end of May to September, we always have an increased number in the Aedes aegypti mosquito indices, so the chances of having dengue will increase, he shared. So I am urging the population to take care of any waterlogged space in your surroundings. Only 5% of St. James's food vendors have permits, says health inspector. The St. James Municipal Corporation has ordered the parish's local health authorities to immediately address reports that only a small number of food vendors who operate in St. James are duly equipped with food handlers' permits in order to protect the public from foodborne illnesses. Montego Bay Acting Mayor Richard Vernon gave the order while chairing the St. James Municipal Corporation's monthly meeting on Thursday after St. James's Acting Chief Public Health Inspector Sharika Lewis revealed that only 30 out of the approximately 600 food vendors in the parish have food handlers' permits. In terms of persons selling food in Montego Bay, and I am referring to persons who are regarded as vendors selling all sorts of different food within the town center and on the edges of town, what percentage of that population is in compliance with the health standards? Vernon asked Lewis during the meeting. From February's report, I think it is less than 5% of those persons. There are over 600 itinerant vendors, and we are able to take action mainly with the ones who are at the schools, but the ones who are on the streets are here today and gone tomorrow, Lewis answered. We have to deal with it immediately, so I will ask you to get your team to start moving around on these cases to see how best we can get them to start getting to a level of compliance, Vernon said sternly. There are complaints coming in where persons have reported some type of illness based on purchasing of food from certain locations. You have to look at it in a fulsome way as it is a serious matter. In speaking about how to deal with the situation, Lewis told the St. James Municipal Corporation that having the vendors apply their trade in designated areas would make it easier to keep track of their hygiene practices. Food vending is a cultural practice, and it is difficult to fully dismantle these persons. I believe that if the municipal corporation would be willing to structure these persons in the vending zones and the sites, it would be easier for us to monitor their practices, said Lewis. What we have done in the past was to conduct food drives for these itinerant vendors, and I know that at some of the schools we have done a hand-washing program with the vendors where we provided a makeshift hand-washing station for them. What we can do is conduct a food drive with the municipal corporation and have these persons there, Lewis added. Over the years, the St. James Municipal Corporation has made several efforts to get vendors complying with the authorities' regulations, including having them sell in designated sections of Montego Bay, such as the Charles Gordon Market. Other measures include the St. James Health Department's thrust in 2017 to engage vendors in hygiene and cleanliness training to counter Montego Bay's perpetual rat infestation problem. Last November, Montego Bay Mayor Leroy Williams identified the migrant vendors as being primarily responsible for the congestion being experienced on the western city's streets. In the meantime, during Thursday's meeting, Vernon announced that talks have begun with the Japanese embassy to provide solar power facilities to the Charles Gordon Market in order to promote environmentally friendly operational practices. Furniture shortage eased at the Bermadi Primary School. The shortage of classroom furniture at the Bermadi Primary School in St. Catherine has been eased with the acquisition of 40 pairs of desks and chairs at a cost of $540,000. The initiative was financed by the Parent-Teacher Association. Principal Melbourne Thompson expressed his appreciation to the PTA, revealing that the furniture would provide seating for grade 4 students. To say I am happy for this furniture is an understatement. I am indeed overjoyed by this gift courtesy of donations from the various stakeholders. The Parent-Teacher Association was instrumental, especially the president, Amoy Levers, he said. Thompson disclosed that the school had received the green light in November 2021 from the Ministry of Education for the resumption of operations, which had been halted by coronavirus restrictions. But the return of the students turned the spotlight on inadequate seating arrangements. Grade 4 teacher Donna Thomas said the undertaking was timely and will ease anxiety among the school population. It was a trying time to see the students standing in class, Thomas said. These desks and chairs will make them more attentive, she said. Levers, the PTA president, said that having been a past student of the institution, it was very important that the required plan to achieve the objective was put in motion. The PTA was summoned by the school about the chronic shortage of desks and chairs for grade 4, Levers said. The serious shortage resulted in us setting about seeking funding. We contacted parents, past students, and businesses. This is the result. The handover took place on Monday, April 11 at the school compound. Don't forget to like, share, subscribe, and hit the notification bell. Select all for daily news updates.